great to be here this afternoon, and it's always interesting. Oh, and there's Joy. I was wondering, I hoped I didn't have to talk about Medicaid or anything, so you can deal with that. I always get, I've been in this business for so long, it's almost 38 years that I've been working on primarily aging policy issues, and you can always sort of get very jaded about what the possibilities are, and then you hear a story about a small home care co-op that's developing in a very rural community in Hawaii or someplace in Wisconsin, and you realize that there's always potential. And so some days, even in the darkest days, the humanity and our entrepreneurial spirit in many ways can overcome a lot of things. I wanted to start with talking about some of the opportunities that are out there through the largest picture of what long-term care looks like today, and also a lot of the barriers. And I actually think the panel this morning raised at the ground level a lot of the issues that I wanted to talk about. I did learn something new today, and that was some of the state barriers to the development of co-ops that actually had nothing to do with the service side, but actually the business development side, which I think is really interesting. And it does raise a question for me, which is, what is the role of the champions of these co-ops for advocacy in terms of not only getting to the people who have these rules and regulations to tell them how crazy these things are in terms of barriers? I didn't even know about advocating for getting rid of some of the business-related barriers to co-ops, but I do think that those are clearly very serious issues. Was surprised, by the way, to find that Oregon had those barriers, because Oregon is generally one of the states that is the most progressive in almost all areas. For example, the scope of practice for home care aides is probably the broadest of any state in the country in terms of what aides are allowed to do in Oregon. So it's sort of interesting that they have some significant barriers to business development around the co-op model. I think that the aging of the population is clearly what is going to be the hope and the dreams and the foundation for co-op models in this area. We are at about 13% elderly. In contrast, Japan is now at about 22, 23%, and they are really, really struggling. If you want to know the problems in the earthquake and tsunami area, they're primarily elderly problems. The vast majority of those populations are over 80. And that woman who survived recently after 9 days, 80-year-old, is an example of why Japan survives so well. They have much longer longevity than we do in this country. But we are seeing that same trajectory for the United States over the next 20 years. The truth of the matter is, though, in many rural communities, we're much further along in terms of the percentage elderly. And that is primarily because of the out-migration of younger people, which makes the need for co-op models so much more theoretically compelling. We just do not have the labor force to support elderly people living in rural communities. And we are actually even seeing an out-migration of the informal sector, as many family members want to move to larger, more metropolitan areas looking for jobs and so forth. So in theory, the co-op model just is ready-made for these rural communities, and I guess I'm a little bit disappointed that from 6 years ago we haven't seen much more development of these co-op models, and I think the question is really trying to understand what the barriers are, and are we taking advantage of all the opportunities that are out there. And let me talk about a few of them. While the Medicaid situation is pretty dire, the ACA does have a number of potential levers for expanding home and community-based services through an increased federal match for Medicaid programs in states that want to expand in that area. Of course, that is a vacuous promise if you are giving people an hour a week. And I think therein lies the real rub for those of us who advocate for home and community-based services. Do we really understand what that expansion means? If it means expanding to programs that offer 1 hour a week or 2 hours, this is not sufficient. In fact, it's actually probably useless. And so I think this is a wake-up call, not just for the folks who are trying to move co-op models, but for everyone who is advocating for home and community-based services, that these have to be valuable programs. And where that money comes from, who only knows, you know, and even in these dire days, they're still raising local taxes in all through Ohio through their county tax levies. And they are able to raise levies in very conservative counties because the people there get that they have elderly populations that need to be supported. So it really is about advocacy in terms of at least helping to support the programs that are going to give the reimbursement that is so needed by these co-ops. A number of other models through the Affordable Care Act that are probably of some interest perhaps to some of the people who are thinking about co-ops, and that is the models around chronic care management. And whether it's the Independence at Home program or some of the accountable care organization activities and transitional care activities, I will say that in order for you to be successful with those kinds of models, you need to be at the table with the people who are going to be getting the big dollars. Because the fact is you have to demonstrate your value to an organization in terms of better care coordination and be negotiating with those organizations in terms of how you get part of those savings. So it's not just about knowing that this is happening, it's about saying we are part of the solution. I think it will be very, very difficult, quite honestly, for home care co-ops to be able to argue that you can take this money and keep people mostly out of hospitals, which is where the main source of savings are, because keeping people out of hospitals is what saves on the Medicare dollar. On the other hand, if you are part of a larger regional effort that is focusing on better care coordination, there may be a piece of the pie that you might be able to get from some of these programs. And as the Office of the Duals in CMS, the new Federal Office for Coordinated Care, gets off the ground and moves out more and more of their demonstration programs, there may be some opportunities for you to think about how you might play a role in some of those coordinated care programs. But if you don't know who's in your state and in your local community who is sort of thinking about those programs, then you're going to miss that opportunity. So it is really knowing your neighbor. And we actually tell that to most of our organizations that belong to Leading Age, which is the organization that I represent. So you really have to know who are the movers and shakers in your community in the care provider arena and how you might be able to partner with them as stakeholders. I also think, and I'm not sure where this will ever end up, because the Class Act is a really interesting, theoretically wonderful, and policy-flawed piece of legislation, but it is the new voluntary long-term care insurance program in the United States. If it gets fixed so that we can set the premiums at a reasonable rate, and if we can encourage enough younger people to buy this program, this is going to be the first middle-class program we will have ever had in the United States that will cover long-term care, and people will literally be given cash to purchase services. If that ever becomes a real reality, this is a true market for home care co-ops around the country. But again, it really doesn't become operational to 2014, and then we're looking at years of really startup. But it is certainly a potential opportunity for markets for co-ops in the future. And in the near term, we also have private long-term care insurance, which only covers about 5 to 7% of current elderly, but nevertheless, that is another source of dollars in the private market for people to purchase home care. And I do think that, as I said before, you cannot just look to the public sector because it is not a viable sector right now. And so in order for startups to really be viable, they have to be thinking about the private sector. What is your market for public and private together to cross-subsidize the real lean pickings that you have right now, particularly through the Medicaid waiver and personal care option programs, which just are not going to be, if anything, they're going to be incredibly lean. You know, ironically, about 6 years ago, they were in surplus and we're actually expanding, and that's just the nature of the beast in the United States. So I think you have to be thinking about the private sector and how you partner with entities, other service providers, and make yourselves attractive to the private payer. I actually do believe there is a marketing philosophy which does say that a co-op with folks who actually are moving in the direction of real careers and are empowered is a better caregiver than somebody you get from the newspaper. And somehow that message has to be marketed to the people in your community who are purchasing services. I also think that to the extent that you can partner with the local workforce investment boards, Bernadette and I were talking about what is the potential for you getting perhaps a piece of the Department of Labor money that gets passed through the WIA funds through the state to local workforce investment boards. Typically, those organizations are interested in higher paying jobs, or at least jobs that have more of career potential. On the other hand, I think you could argue that the co-op is providing greater potential for this workforce. And if there is a way to partner around developing these careers, perhaps even sort of engaging in some of the training and the in-service support for this workforce, there may be a way for you to think about the Department of Labor as a stakeholder. But I do think you have to, again, understand your local workforce investment board. What does that community look like? Who's on the board of the workforce investment boards? Get on the board of a workforce investment board so that you can actually leverage those dollars. That is another stakeholder that you could possibly think about. The barriers, you know, again, are the state budget crunches, and you've heard all of the horror stories, and they're actually worse than even what you have heard. I think the real unsung question is whether this new movement towards consumer direction is really a smokescreen for worker exploitation. And as one of the sort of mothers of consumer direction, having created the cash and counseling demo when I was in HHS, we never, ever expected that this would become an exploitative program. I think it is really time for us to take a look at the state consumer-directed models and ensure that there are true worker protections in those programs. If you're going to develop co-ops that are based on those dollars, we have to be at the table making sure that the protections are there for the workforce. I also think that you have to think about the competition with the for-profit home care agencies that are like popping up all over the place. I just came from Texas last week where there's like a for-profit every inch, although they've sort of been a little dissuaded after prospective payment came in for Medicare home health. But now they're just like moving away from home health and moving into home care wherever they can get a dollar. You are definitely, the potential for the co-op model is so much more quality than the for-profit agency. And how you get that message to the market that's buying from the for-profits right now. But again, I think it's a real marketing question in terms of what is your value add in the community over the local for-profit that may be able to underbid you a little bit, but is not really providing the quality that you are offering. I do think that the issues around questions of transportation, I mean, that is the no-brainer in rural. We hear it, I mean, if you ask any elderly person what is their major problem is transportation. So, there's only two ways you can skin that cat. One is that becomes one of your major stakeholder partners. The other is that you are also engaging significantly more in telehealth and combining the use of technology around monitoring and oversight and creating virtual community for these folks. We talked about Skyping and no Skyping in Hawaii, but the fact is we could be Skyping home care workers and elderly folks. And we have examples of virtual senior centers now in a number of places that are with very, very disabled elderly who are using computers to actually be connected. So I think it's got to be a combination of exploring technology, and it's probably a cohort issue. I think younger cohorts are going to be much more facile with technology. Even lower income people are facile with technology. So the combination of technology, but also partnering with transportation, co-ops, to think about how you meet the needs of rural elders is going to be key. The business infrastructure question is a big one. I mean, that is a significant barrier. I have always thought about it mostly as volume. If you don't have enough volume, how can you possibly be? I really didn't understand some of the business barriers for just the development of co-ops. But to me, the answer to that is advocacy to get rid of those barriers. Because what I was just hearing this morning, that doesn't make any sense to me. I also think that right now, training is a real barrier. We don't have training that is viable for most home care workers. I think Leonilla was talking about the work that the Direct Care Alliance, and I am on their board, and for their competency program and their credentialing program, and they have moved the bar around credentialing. But we need to be making that the norm rather than the exception. And so how you think about partnering in the training arena, including partnering with training programs in your states and in your local areas, and sort of try to get a piece of that pie, wherever that pie is. But it's not just the orientation training for home care workers. It is actually the ongoing in-service, because there is so little infrastructure on the home care side. It's not like you're in a nursing home where you have economies of scale and people that you can bring together. You need to figure out other ways of making viable ongoing in-service training programs for the workforce, and in areas like dementia, in medication management, in transitions. I think Leonilla was saying, and I do think the opportunities for home care aides to really be part of the solution in not only transitions of folks out of the hospital back to the community, but actually keeping people out of the hospital in the first place. The goal should not be to transfer people out. The goal ought to be to keep people from going in. And what is the role of the home care aide as the eyes and the ears of the entire organization? And most important, can you get paid for that? I mean, I love these stories about what these folks do, chopping wood and, doing whatever, but the reality is this is not a valued profession unless we get paid for it. And we're not paid for it unless we're valued. So we're sort of in this catch-22 situation. And I do not believe that co-ops can be just sort of getting the residuals here. They have to really be part of the major business plan in keeping people, elderly people, in the community in rural areas. And I think finally, the last barrier that I would talk about, and I think that Leonilla talked about this and really hit the nail on the head, is this isolation question. And I think there is isolation both with the workers and with the consumers. And that is where the co-op can be part of the solution in terms of really trying to mitigate the isolation of both elderly folks living in very rural communities and the workers who are frequently isolated. Can the co-op become a different model? The ones that we know, certainly in the South Bronx, in Philadelphia, the Wisconsin program, these have become communities for the workers. This is not true of your average home care agency. Your average home care agency is not a community for the workforce. Home care co-op is a totally different model where people own their own stake in their business. They are committed and are accountable, and they have a community of like-minded peers. And I think that is one of the values of a co-op model that goes beyond just the business, but also begins to mitigate some of the isolation that a lot of workers feel either when they're hired independently in the shadow market or when they're working for a home care agency, which really just, for the most part, considers them a warm body. So I guess the question is, I'd finally close with the policy question of what is the role for home care co-ops in advocacy? Because I didn't hear enough of that this morning, and I think that you are a fledgling constituency that has to have a voice in terms of changing the barrier, getting rid of the barriers to developing the business model, being part of the advocacy that says that we don't want cuts in the Medicaid program, or we want the Medicaid program to morph into something that is much more amenable to supporting a workforce as well as elderly consumers and their families, and also advocating for other programs in the Department of Labor, in transportation, in HUD. I think the real question of the question of being on the other side of the island in Hawaii, and you can't get there because you live on the wrong side. You know, HUD is at least hearing a little bit of this in terms of thinking about worker-based housing, and how do we advocate for accessibility so that people have the kinds of communities that have been discussed, which is really sustainable communities where elders and workers are living together in a healthy environment. So I think there's a lot of opportunity. I'm a little surprised that the co-op model isn't further along than it is right now in the home care field, because this is probably the second fastest growing occupation in the country. And I think it's probably some of it is obviously just the significant challenges of developing these co-ops, but it's also the ignorance of other people in your community, even the chambers of commerce, that don't get the fact that these are where the jobs are going to be. This is where economic development will be in many rural communities. This is all there is. So is the home care co-op a viable model for the business sector? And can you get consumers and families to advocate with you in terms of helping to support these models, which are going to be not only potentially more effective, but also address some of the issues of exploitation, which I think are really going to be key. So thank you for the opportunity. I love the morning session because it gave me some hope that we're still on the right track, and I look forward to the rest of the day and continuing to work on this project.